All right, we have 6:03. Can someone chime in and let me know that you can see my screen?
Yep.
Okay, great. Right, good evening, everyone, and thanks so much for joining. Tonight is our virtual public meeting for the RiverCOG Comprehensive Safety Action Plan. And if you don't know what that is, or if you don't know who RiverCOG is, I've got great news. We'll be defining all that shortly. But so last night we had our in-person public meeting in the Chester Town Hall. This is a really exciting project for a number of reasons, which we'll be talking about throughout. But before we get kicked off and before I introduce myself and the team, I just wanted to go through some of the meeting protocols for tonight. So this meeting is being recorded. So just, closed captioning is available if you need it. And then participants will be muted during the presentation. But if you have any questions or comments pertaining to slides, please use the chat tool or raise your hand. And Hannah will interrupt me and we can address your comment or concern as we kind of go along. If at any point you maybe lose connection or need to call in, there's a phone number provided on the right you may want to write down, as well as the meeting passcode. And if you need any help with Zoom at any point, you can either send a note to the chat or email sgrossman@fhistudio.com. All right. All right, so just to introduce you to the project team, this project is run through the Lower Connecticut River Valley Council of Governments, otherwise known as RiverCOG. Rob Harrimet is really leading the charge here. And then as far as the consultant team, FHI Studio is the prime consultant, and I work for FHI Studio. I'm Michael Ahilin. And then Hannah Brockhouse is the deputy project manager. When you see the Zoom technical host, that's Sarah Grossman, who's behind the scenes making sure everything goes as smoothly as possible. We're very fortunately joined by Colleen Byrne, who's the safety analysis lead for this project, and she works for Ty and Bond. All right, so just wanted to provide a project overview, and we'll start by talking a little bit about RiverCOG. Rob, did you want to chime in and introduce RiverCOG to everyone?
Yeah, sure, no problem. As Michael said, RiverCOG is the Lower Connecticut River Valley Council of Governments. We are one of 9 COGs within the state. Basically, the COGs used to be regional planning organizations and others. They recently, maybe a couple of years back, all converted into COGs. Basically, the difference is just the makeup of the board. Our board is made up of the chief elected officials and town managers of the 17 towns in the region. And basically what the COGs do is, look at regional issues, at the local level and the regional level, things such as shared services and coordinated planning. We do a variety of planning, land use planning, environmental planning. I'm the transportation planner. The COG is also an MPO, which is a Metropolitan Planning Organization. These were designated by Federal Highway back in the 60s of areas typically of greater than 50,000 in population. As a transportation planner, I'll start by giving a little background on the SS4A project. SS4A is Safe Streets and Roads for All. It's a new federal highway discretionary program under the current federal transportation bill. So that's basically, as we had said, we're the COG, and we had hired FHI to begin working on this important regional study.
Cool. Thanks, Rob.
Yeah.
So providing a little bit more detail on the Safe Streets and Roads for All program, this is a really exciting program. It's very new. I'm working on a number of these projects throughout the Northeast, and RiverCOG is really at the front end of getting one of these grants. So it's a very exciting grant. Why this is a significant grant and why it really matters to you is in order to do all of the safety projects or even some of the safety projects that you want in your own town or your own community, you really need funding for those projects. The Safe Streets and Roads for All program is this new dedicated funding source, and it's quite a bit of money. It's about $1 billion a year nationally over the course of 5 years that it's going to be released. But in order to access this money or to even compete for it, you need to have a comprehensive safety action plan like the one we're doing now. And that plan has a variety of different components, but at its most basic intention is what we're trying to do is to prevent serious injuries and deaths on our roadways. And this program is really focused on what we call vulnerable road users. These are non-motorists such as pedestrians or cyclists. And the US Department of Transportation is really encouraging prioritizing vulnerable road user safety on all the roadways. Um, so, or all of the roadways that allow bicycle and pedestrian use. So within our region, the RiverCOG region, it's with the exception of the interstates, as well as Route 9, which are limited access. So people who are biking or walking aren't allowed to go on those roadways. So it's not a part of this study, but all other roads, everything from your local street all the way up to state roads is included as part of this study. Why the vulnerable road user component is so important is because nationally there has been an uptick in recent years of crashes involve and fatalities involving non-motorized users. So the graphic on the right is from the state of Connecticut, and we're seeing since about 2015 there's been a slight increase, whereas over the course of most of our lives we've been seeing a decline of these fatalities and serious injuries occurring. The US Department of Transportation is aware of this trend and really trying to address it. And this program is one of the primary ways that it's doing it. So it's a very important program. And it's very exciting that RiverCOG was able to get this grant. This program uses something called the safe system approach. And again, this is really about eliminating all roadway fatalities and serious injuries, really for all road users. Something that's really important to remember about this approach is that infrastructure is one piece of the pie. It's a very important piece of the pie. It's a very important piece of how we're addressing safety. And if you look on the graphic on the right, so that safer roads, much of what we'll talk about tonight involves safer roads. I want everyone to know, though, that the remainder of this project, in addition to talking about infrastructure, we'll also be talking about some of these other elements. Education campaigns for the safer people, safer vehicles, safer speeds, enforcement, post-crash care. All of these are really important elements to helping us achieve that goal of eliminating all roadway fatalities and serious injuries. You might think, okay, well, this seems pretty obvious. The safe system approach seems about right, but the conventional approach and what has been this is really a paradigm shift that we're undergoing here. In the conventional approach, traffic deaths were seen as inevitable. In the safe system approach, we're seeing them as preventable. Whereas then the conventional approach, the goal was to prevent collisions, no matter the severity. Safe system approach is really focused on preventing the fatal and serious crashes because within any given geography, we're finding that it's a very small portion of roadways that account for a very large portion of fatal and severe crashes. The conventional approach really thought of, perfect human behavior. We should assume that. Safe system approach integrates human error into design. So thinking about the redundancy in the network that need to exist so that we're seeing that elimination of fatal and serious crashes. And then last but not least, thinking about individual responsibility was kind of the conventional approach. The safe system approach sees a more system-wide perspective that safety is really a shared responsibility, everyone from drivers to engineers to enforcement to policymakers. All right, so before I go on, I just wanted to pause and see if there are any questions in the chat or if anyone has their hand raised to address any concerns or questions that they may have about the program or RiverCOG.
I don't see any questions at this time, but I know we had a couple of people jump in late. So if you are just joining and you have any questions, feel free to drop them in the chat or raise your hand.
Great. All right, thanks. And for anyone who was late, we were just kind of going over the Safe Streets and Roads for All program. So hopefully you're here for a regional safety program, which is what we're all working on tonight. All right, so just want to provide a little bit of an update and context for the overall plan and where we're going. So the town of West Hartford has developed a Vision Zero action plan, which is very similar in a lot of ways to what we're working on now. And it's a it's a methodology that we're using to really identify projects that have the greatest need and will be the most competitive for a Safe Streets and Roads for All grant. There are other grant programs, so we're not forgetting about those, but this program is really looking at, we'll call them kind of three different prongs. The first being what has always kind of been a traditional approach to prioritizing projects, really looking at taking crash data, so the historic crash data, and isolating the locations that have the highest historic crash rates and number of crashes total. This creates what's called a high injury network, and this is one that we're developing, and Colleen will be presenting the draft version of shortly. So this identifies the small portion of roadways that are accounting for a disproportionate share of fatal and serious crashes within a given geography. The next thing that we're looking at is equity. This is a really important value of the U.S. Department of Transportation. So it's thinking about communities that have been historically underrepresented in planning processes and also trying to address a nationwide trend. There are a disproportionate share of crashes that are occurring in environmental justice communities, in transportation equity zones. And this is something that's happening at the national level. So the U.S. Department of Transportation is really trying to reverse that trend and really concentrate some of its investments in locations that display kind of the greatest need. And then last but not least, showing strong community support. This program is really eager to see projects get done. There have been a lot of projects nationally that have maybe not succeeded because they were going in locations or they were a certain design that didn't address the community need. So we have developed a community web map. We're having public meetings like this one. We've had stakeholder interviews and a number of other elements to really try to understand what the areas of concern are most prominent within your region. Where this is all leading is we'll be developing a variety of recommendations. And if you remember that kind of wheel graphic I showed earlier, there's kind of infrastructure improvements, there's enforcement, there's education, and there's policy components. I suspect that tonight will largely be focused on kind of infrastructure. If you're, perhaps here to talk about a roadway near you that is a particular concern, that falls into that bucket. But if you have any questions or comments about enforcement, education, or policy, we'll certainly take them, but those will be the topics of future meetings as this project progresses. Okay, so as I mentioned, this project is really kind of toward the beginning. This is the first round of public meetings that we're having. Summer is traditionally kind of a low participation month for public meetings, so we actually went out to the public and had some pop-up events. So we went to the transportation hub in Middletown to speak with transit riders. We've been to farmers markets. We went to Clinton Summerfest, all to get some feedback about safety concerns within your region. Ongoing, we have a study advisory committee, which is made up of representatives from a variety of different communities, as well as special interest groups such as the Chamber of Commerce, bicycle and pedestrian advocates, and others. And we're having stakeholder interviews throughout the process as well. A big piece of all of this has been the virtual engagement mapping tool, which is still live and has been live since the summer. And so far, we've received over 600 submissions. Just really brief kind of update on this is that nearly 2/3 of the comments we've received so far are about driver behavior, whether it's speeding, cut through traffic, distracted driving, running through stop signs. Those are really the dominant concerns that we're hearing. When it comes to kind of the other concerns, pedestrian safety and then visibility concerns continue to account for about 1/3 of the rest of the comments. So there's a strong desire in your region for safety for pedestrians, developing infrastructure that supports pedestrian safety, such as high visibility crosswalks or sidewalks, but also having accessibility improvements. So if you're in a wheelchair or if you are pushing a stroller, or have any sort of cart, it's really nice to have that sidewalk ramp in your community. And we're hearing that really all over the place, but particularly in town centers, commercial corridors, shoreline communities, and near schools. And then last but not least, I really want to highlight this because it's really an important takeaway from the tool that we've had so far, and Colleen will discuss this a little bit more. most of the concerns we're hearing are on state highways. For those of you who come from communities where the most prominent roadways are state highways, it's probably not surprising to you. The locations that have the greatest number of traffic and the highest speeds, there's a lot of concerns about safety rising in those areas. So certainly a focus, but I definitely don't want to exclude any sort of local roadways that you might be we're concerned with. But we are thinking about every kind of roadway in this area with the exception of the interstates and Route 9. All right. So, Hannah, was there a comment that came in?
That was just me putting the online map tool in the chat for anyone that might want to view it.
Yeah, so if you haven't entered any feedback into that chat, feel free. It's a really useful tool, and we'll be using it throughout the study. All right, so I wanted to talk through next sort of kind of the existing conditions. We've done a lot of existing conditions review for this. We've reviewed the existing planning context, so look at plans that you have perhaps developed or helped develop before. We've done a lot of base mapping and equity assessment, which I'll get to in a second. And then really the most important kind of conversation coming from this is going to be the high injury network and the critical crash rate locations, which Colleen will present shortly. But before we get to that, let's talk a second about equity. So equity can be measured in a variety of different ways. And when we release the existing conditions report later this month, you'll be able to kind of dive into a little bit more detail. But we've done kind of a local analysis. We've used statewide tools and we use national tools to help us identify the communities that have, the greatest need for transportation investment. This can be measured in a variety of different ways. The federal level, they're very concerned with environmental justice in the sense of kind of diesel emissions and other sort of environmental factors. Statewide and locally, concerns about transit access, for instance, particularly in communities that have a lot of households with zero vehicles. Those are, tend to be areas where you see a lot more pedestrians and cyclists on the road and therefore are, more in need of safety investments from the Safe Streets and Roads for All perspective. But this is also really important for us because we really want to engage underrepresented populations through this study. And this is true in a variety of different ways. We obviously reached out to transit users just because it's really hard sometimes to get transit users to come to public meetings, if venues aren't easily accessible. So we're working really hard to engage a lot of different populations. We also really want to have some geographic diversity. As people mentioned last night, you've got, a pretty big region here stretching all the way north from Northern Edge and Cromwell, Portland, all the way down to the shoreline communities. So there's just a lot of different communities in this area. And even though you might only be 30, 45 minutes apart from each other, it's very different in a lot of different perspectives, and we want to make sure we understand those nuances. So we're trying to have meetings in a lot of different locations to capture the different perspectives. All right, so at this point, I'm going to hand it off to Colleen to talk through the crash analysis, and I'll frame it as, this is some pretty technical stuff. So please, if you have any questions, please drop them in the chat and we'll pause and kind of clarify anything that comes up. All right, Colleen.
Thanks, Michael. So as Michael mentioned, I'm going to review the safety portion, the data analysis portion that we've completed so far as part of this study. And it is very technical. So feel free to drop your questions in the chat, but starting at the highest level and the overview of what the safety analysis entails. We're looking at the entire RiverCOG region. So all 17 towns that are encompassed and serving over 175,000 people that live there. We're looking at every roadway in the region, all public roads except for those limited access highways that Michael mentioned earlier. So your Interstate 91, 95, and Route 9, where our priority population, our vulnerable road users are not accessing those roadways. And then when we looked at the data, this is all the crash history. So those crash reports that are generated by the police officer that might show up when there's an accident. All of that data is compiled, and we're looking at a 5-year period from 2019 through the end of 2023 when we're analyzing this data. And with that focus really being on our fatal and serious crashes. And then I'll talk a little bit later, but with a predominant focus on looking at those vulnerable road user involved crashes as well. And all of this data is coming from a central database that's maintained by the state. It's called the Connecticut Crash Data Repository. Next slide, please. Thank you. So kind of starting at the highest level and working our way down, I'll present some takeaways, some key themes that we identified as we were evaluating the data. So first off, where are these crashes happening? And as Michael mentioned earlier, because there's such a predominance on state roadways, a lot of them, 74% in fact, are occurring on state roadways. And looking at, what is the result of these crashes? So of all of our serious and fatal crashes that are occurring, unfortunately, 21% of them are resulting in fatalities and 80% are resulting in a serious injury. And then who's involved, right? So the majority of them are motor vehicles, which is to be expected, but we did have 10% of these fatal and serious crashes that involved a pedestrian, so 22 crashes over that 5-year period, 4% involving a bicyclist, and then there was one crash that involved a scooter. And as we dive a little bit more into the data, we can start to see, if you want to hop to the next slide for me, Michael, the types of crashes that we're observing that are resulting in either a fatality or a serious injury. And as you can see in this ranked graphic towards the bottom, we have our angle and fixed object crashes, which have the highest frequency of crashes, crash types that are resulting in either a serious or fatal crash. So angle crashes are a T-bone crash or a crash involving a turning vehicle with an oncoming vehicle. And then a fixed object crash would be something like either a building or a light post, a utility pole, a tree, a car making an impact with a object that is stationary. So this gives us a little bit of insight when we're looking at potential recommendations. These are the types of crashes that we're seeing overrepresented in those crashes that are resulting in either a fatal or serious injury outcome. As we look at the crash data in a different way, so this represents a time-based evaluation of the crashes, the fatal and serious crashes that occurred over the 5-year period. And the graphic on the left is showing a month-by-month breakdown. And we can see that in June, July, and August, we have a spike in our serious and fatal crashes occurring. We know that our shoreline communities get a lot of attention in the summer. We also know that there are more vehicles on the road in summer when people are traveling for vacations or just out and about because the weather is nicer. So for various reasons, there can be an increase in these crashes, but this lets us know that there's a potential for safety improvements surrounding those times a month, whether it be through either targeted education, potentially some awareness campaigns, or even enforcement through speed or aggressive driving or distracted driving. And then when we look over to the graphic on the right, this represents a weekday, so your average weekday, and the fatal and serious crashes that are occurring by hour of the day. And probably not much of a surprise, but 4 to 5 p.m. represented 10% of the overall crashes. And again, 6 to 7 p.m. representing 9% of the overall crashes. So we see that kind of that rush hour commuter peak period that we're used to seeing on a weekday in the afternoon, representing the majority of the crashes occurring during that time. Again, that gives us, some potential opportunities to look at improvements surrounding those times of day with maybe enforcement or some awareness campaigns. And then looking at the data, yet another way, this one I find most interesting is looking at behaviors that are involved in our crash trends, and specifically, again, those crashes involving a fatal or serious injury outcome. We see that while 81% of crashes had a driver that was not driving under the influence, unfortunately, 19% of those crashes did involve a driver who was under the influence. And then again, on the right, we can see that 61% of the crashes involve someone using a seatbelt, which is good that people are using a seatbelt, but 26% were not wearing a seatbelt. when the crash occurred. So 13% being unknown or unreported, which, you know, the police officer was not able to determine if the person was wearing a crash or a restraint at the time of the crash. But we can see, you know, just looking at these trends, that there is some potential for improvement with enforcing or reducing the amount of crashes that involve a lack of use of restraint. So those are just some of the key themes and takeaways, but I think we can, if we have any questions regarding any of that data before we move on.
Yeah, so maybe we'll pause, see if anyone has any questions, comments, or concerns about some of these findings.
Yes, Beth?
Yeah, I'm just curious, as you're looking at the data from these repositories, if you're also able to analyze whether the collection of the data is solid, and or if you'll be able to make future recommendations as to the way the data is collected, particularly so that you get better data around pedestrians and bicyclists. That's all. Thanks.
Yeah, so this data all comes from crash reports that are a standardized form that's completed for every crash that occurs within the state by the reporting agency, which is typically the local police forces. So the data is somewhat standardized in that we get the same set of data for every crash that occurs. And it is standardized in the fact that all of the towns, so we have 17 towns in the COG, they are all reporting to the same system. But we do also then clean the data. So that means that we go through all of the crash reports and look at each one of them and make sure that nothing is off or something didn't maybe happen at a private parking lot. And make sure that the data that we're using is as accurate as possible when we make these findings. Hopefully that answered your question, but if not, let me know.
Yeah, no, I think it does, but you know, I just know in the past, and perhaps it's getting better, that there have been problems with the way in which the crash is reported by the police. And so I just want to make sure that if you think that there's some anomalies and ways to better inform that data sheet that they're all using, that would be part of the end results of the work you're doing. So no need to say more, but I guess that was a point I wanted to make.
Yep, got it. Thank you for your comment.
Okay, thanks.
Selena? I hope I'm saying your name correctly.
It's actually Paul. I'm just on her computer.
Yeah, there we go.
No, I actually came in a little bit late from work, so I kind of missed most of it except for the last few minutes. But what I was wondering is one of the biggest things I've been, and I don't know if we got to this point or if this is for later on, but one of the biggest things I've been pushing for in this town is to have a red light camera at the end of Jackson Hill and 66, because I can't tell you how many times I've seen up to 4 or 5 cars, you know, go run the red lights that are on 66, and I'm sitting there waiting at, you know, a green light to go. And it's, you know, it'd be an easy way for the state to make money. And it would also be, I know from living right down the street from it, there's constantly the fire trucks going there to deal with accidents.
Yeah, so I'll talk a little bit about some of the roadways that appear on our high injury network next. But Route 66 is not unfamiliar to these maps. So we'll touch on that in a little bit and some of the potential solutions that are available.
Oh, okay.
Right. Any other comments? All right. So with that, we'll head on to the discussion about high injury network.
All right. So I gave some like key takeaways from the data, but there are so many data points that come in, and those are just some of the themes that we identified that we found interesting to present. But there are many more data points that we analyzed, and really what we did was use a methodology to identify the top crash locations within the region, so the top 10 in this case. And that's what we call our high injury network. So these are the most critical locations that are typically overrepresented with fatal crashes or serious injury crashes. And these are all roadway segments, so they might encompass a stretch of road, potentially intersections in between them. But really, these are the top locations where we see the most fatal and serious crashes occurring throughout the entire region. If we want to hop to the next slide, we do have a little bit of a blow up of that table that's in the bottom left corner of the map, so you can see some of the locations a little better. But in the more developed area, particularly in the Middletown region, we do see Route 66, as I mentioned before, popping up, not in the Portland section, but that is a common corridor that we identified throughout the theme as a theme throughout this analysis. There are actually 2 sections of Route 66 showing up here, and then two roadway segments in Durham between Route 17 and Route 77. And then you might notice that these are all state roadways. So as I identified earlier, the majority of the fatal and serious crashes that are occurring are on state roadways, and we can see when we prioritize them through our analysis that all of these end up being state roads as well. So this is one way that we looked at the data, and then another way that we looked at it was a critical crash rate analysis. And this methodology does not it takes the volume of the roadway into account more than the severity of the crash that resulted from it. And this allows us to look at and identify locations where potentially serious and fatal crashes aren't occurring, but maybe there is a risk indicator that there may be those potential for more serious results from these crashes. And when we look at this map, we see that now our shoreline communities are showing up a little bit more. We still have that cluster up in the Middletown region where it's more developed, and but now we see that our Old Seabrook and Old Lyme, Westbrook, and Clinton are now popping up a little bit more, and that just allows us to know that maybe there's a potential risk indicator for more serious crashes to happen, because we know crashes are occurring even if they're not resulting in a serious or fatal outcome. These are both segments and intersections, so this also looks at specifically intersections, not just segments of road. Just to clarify, the yellow numbers are roadway segments, and the blue numbers and dots are intersections. So when we look at this, we can see on our table blown up here that these are the top 25 locations. Middletown, again, is overrepresented. I think there are 8 references to roadways in Middletown on here, Route 3 and Route 66 again popping up, all state roadways again. And then we also see Durham having 2 locations represented, but then Old Seabrook has 5 locations within town that are represented on here. So we know the crashes are happening at these locations at a higher rate as compared to the roadway volumes that are on the roads, but they may not be serious or fatal yet, but we need to keep an eye out because there's a potential risk being observed there. So with that, I think we can, I'll just summarize before we take questions. So, as I mentioned before, on the high injury network and the critical crash rate locations, we're seeing that density in that highly developed, more urban area in the Middletown and the northwest corner of the region. But then the shoreline, it comes in where there's a higher frequency of crashes, but maybe they're less severe. And then obviously our highly traveled roads, our arterials, our connectors, those state roadways that are frequently and heavily traveled are dominating the top locations. And we really use this data as one of the factors in the study to identify locations where we might have potential projects to implement safety improvements as we complete the study in the next stages to reduce those the safety risk at these locations where we're seeing a crash history. So with that, I think we can open it up to questions or comments.
Yeah, Colleen, I think we can start with just a few questions in the chat. Two of which discuss the seatbelt stat. So maybe we can go back to that slide. I know when we had previously discussed kind of some of the explanations for why this is so high. Karen commented that there's a high percentage of those not using seatbelts, and Erica Odoff commented that she was curious to know the ages of individuals not wearing seatbelts. She's stunned that it's such a high number. At 70, she can remember learning to automatically use one. Although everyone younger grew up without other options.
Yeah, and this is why I put this in the presentation, because it is so surprising, and we know that seatbelts save lives. We've heard it all of our lives growing up in public safety announcements, but yet people are still not wearing their seatbelts. And when crashes are resulting in a fatal or serious outcome and a seatbelt isn't involved, you expect the injury to be a little bit worse, right? If you're not wearing your seatbelt. So it's surprising that the numbers are so high, but somewhat not surprising that this most serious crash outcomes resulted with someone who wasn't wearing a restraint.
So just to kind of put that another way, the part of the reason this might be so high is that this is only looking at the crashes where a serious or fatal injury results.
Exactly.
Yeah.
Yeah, this is not looking at all crashes, it's the ones that resulted in either a fatal or serious injury. To answer the question about the ages of the individuals wearing the seatbelts, I don't have that data handy, but that data is available to us. And you have to keep in mind that it may not have been the driver of the vehicle, it could have been an occupant as well that was injured or fatally had a fatal result in the crash. So it could be more than one individual in a vehicle involved in a crash as well.
James Irish had the other question, comment that is in the chat, and I see he's raised his hand, so I'll just start by reading the comment out loud. It's asking about confirming whether that the data is from non-interstates and not Route 9. And James, you can go ahead and add to that.
Well, my question is more following up on a comment that Paul made earlier, and it had to do with an intersection in Middlefield. And on Route 66, we have quite a few, they're not fatalities or maybe even, I guess, serious injuries, but we have a lot of collisions on Route 66 on the intersection of Jackson Hill, as he mentioned, and also at the intersection of 66 and 147. Speed limit on the road's 40 miles an hour. Typical speed is somewhere between 55 and 60, all the way over to the Middletown town line through both intersections. And I'm wondering, what's the easiest way to ask for some priority on these areas that are maybe not fatalities or serious crashes in the database, but they are continual issue areas? Do we just put them on the map and or is there another way to get some priority on thinking about them? Thanks very much.
I can start that one, and Rob, I might hand it off to you to talk about some, potential other programs. But to answer your question briefly, yes, definitely add it to the map, because not only is the map just useful for us for prioritizing corridors for this particular project, the end result of this project is we'll have at the municipal level the roadways that are kind of the highest ranking, the ones that have the most community concern, and then of course the equity zones. So in the event that a municipality wants to pursue their own individual funding, they'll have the tools available to do it. But also it's really useful information for their other grants. So Safe Streets and Roads for All is a big, exciting new program, but it's definitely not the only program in town. There's a lot of different opportunities, at the state or federal level to pursue grants, and having that information and that feedback documented is going to be really critical for the success, particularly for the really competitive grants that come through a variety of different sources. Rob, did you want to talk through any particular programs?
Yeah, maybe a couple that we had mentioned yesterday. I mean, it was LOTSIP and the Community Connectivity Program. I mean, those are two other funding sources. There's the federal Transportation Enhancement Program and things like that. I don't think in Middlefield, I don't remember a road safety audit over there, but they may have done one. Basically, I mean, just by having all this information, documented, it will help with, not just SS4A, as Michael said, but other programs as well.
But yeah, so definitely please add that feedback to the map, and we're taking notes as well here. So we're kind of documenting what other people say as well, because I know not everyone wants to go through the process of using this map, even though many people have taken advantage of it. But your feedback is noted.
Okay, there's another question in the chat from Paula, who says that she thought this was going to be more local and asked if there are plans to make Chester more walkable.
Yeah, sure. So yeah, understandable. I think, Chester did a great job of getting the word out, and I know that there's kind of local concerns, and we're focused kind of at a regional level here. But absolutely, any concerns or ideas that you have about Chester, particularly the walkability environment, is still very relevant here. So if you have any roadways of concern or places that you would like to see increased focus on pedestrian infrastructure, definitely either leave it in the chat or drop the feedback into the mapping tool that Hannah provided the link for, because it's still very much relevant for all the reasons that we kind of talked about, both within the context of the Safe Streets for All program, but also these other funding mechanisms that can really bridge administration and action, and seek the walkability that you're requesting.
Yeah, and in Chester, there has also been, there's been some work done recently. I know there was, there was a road safety audit over there. There's the Loop Trail with Haddam and East Haddam, the Heritage Trail. So there has been a little bit going on.
Any other questions or?
Nothing else is, oh, there's another comment. So Paula, we will document that the location that you put in the chat. And Paul, go ahead. Oh, okay. Paul, are we able to unmute you? Oh, it looks like you were unmuted for a second there.
Let's try again. Can you hear me now?
Yeah, there we go.
Okay. Will this activity lead to like red light cameras or increased police enforcement, or is this what is the ultimate goal that we can look to expect out of this?
Yeah, Colleen, I might call on you actually for help with this one. So I used West Hartford as an example earlier in the presentation. I'm not sure if you saw that. But West Hartford ended up pursuing and actually successfully getting a grant through Safe Streets and Roads for All after completing a similar plan to this one. And what they pursued their funding for was a speed camera pilot program. So they chose that, right? So I think they've selected 12 to 15 intersections, something like that, to install these cameras as part of a critical piece of their Vision Zero action plan. So that is one potential option and one avenue to go down for this. We're still early in the study, so I wouldn't put an expectation on that just yet. But that is kind of one use of the potential, for potential funding.
Yeah.
Oh, okay.
The automated traffic safety enforcement devices are something that is newer to Connecticut. So these were recently approved by the state earlier this year, so almost a year now. Some municipalities, as Michael mentioned, like West Hartford, are pursuing the opportunities to use these cameras. We have speed enforcement cameras, and then we also have red light running cameras as options. And they can be used in specific situations. School zones, for example, is one area where speed cameras can be implemented. Red light cameras can be used at intersections that have a high predominance of red light crashes occurring. And there are many, it has to be approved by the state. So there is, a process that has to be worked through. But, as Michael said, no expectations, but it is an option. It's a tool in our toolbox that is now available in Connecticut.
Oh, cool.
Okay, I think the next hand I saw up was Karen.
Hi, I think I finally unmuted it. I know one of the areas was on your next map, the top 25 concerns. So my concern is Connecticut Route 80 and Rosemead Hill Road. In the last 2 weeks, we have had 2 additional accidents there. There was just one on Saturday and one the week before. We haven't had any fatals there, but it's just a matter of time. People don't stop at the stop sign coming from Rosemead Hill, and they drive right across Route 80. I've almost been hit there in the evening myself. So that is a real concern for me, that it's going to be just a matter of time before that intersection has a fatal accident. Thank you.
Thanks, Karen.
Okay, at this point, I don't see any other hands. I do know there's a number of things in the chat that have come up. Jim noted some comments about Chester walkability. And Erica noted that several folks in Chester have used the interactive map to identify specific locations. Let's see. She also noted that she's a huge fan of regionalism and wonders if this is not the right place to follow that. Where should they look for more detail? I know we had some questions about this last night. Maybe we can coordinate with our representative from Chester on our committee.
Yeah, so Cindy is a very active member of this of the committee, and we'll certainly be coordinating with her directly and giving her, the feedback that we've received tonight, and also kind of the concerns that are just raised about general walkability within Chester. So certainly continue to provide that feedback in the chat or just raising the hand. We'll convey that to her. She was there last night, and definitely listening and aware of kind of the local kind of concerns in the area. But she emphasized to me after the meeting the real importance of documenting all of this, because again, Safe Streets and Roads for All, very exciting new program that has more money than a lot of programs, but it's certainly not the only one. She's been pushing ahead a number of initiatives, the road safety audit that you've already had there, and some other elements. It's a little bit of a lengthy process, but we need to have these comments documented to see the funding actually come through. But yeah, really appreciate these comments.
Okay, I think at that point,
More.
yeah, Erica is saying that she was hoping to be there at the meeting last night. So totally reasonable. That can happen.
Yeah, it was a rough weather night, but many of your neighbors were able to make it. Okay,
all right,
great.
so I think we can move on to the next section.
Okay, great. Okay, one other thing I wanted to touch on before we wrap, and obviously take additional comments, but I did want to touch on kind of the goals and vision, seeing that this is really the start of a longer process I do want to mention a really critical piece of this. You've heard me say the words Vision Zero a few times. You've perhaps heard me talk a little bit about the goal. When it comes to this comprehensive safety action plan, one of the elements that the U.S. Department of Transportation is really seeking is a commitment, an official public commitment from a high-ranking official to eliminate roadway fatalities and serious injuries. The term Vision Zero, this is a concept that's been around for a while, but it's the vision is, is seeing zero fatalities on roadways and serious injuries. It's a movement that really began in Europe, but has certainly spread in the United States, and is in a lot of cities in the United States so far. And this particular program is really accelerating the adoption of these policies. So this policy will entail either a target date for achieving zero roadway fatalities and serious injuries, or an ambitious reduction in roadway fatalities and serious injuries by a specific date. So these are this is a really critical piece, and it might seem really high level and really future oriented, but it is something I just wanted to raise and discuss with everyone, because bring it back to the safe system approach. There's a lot of different pieces here, and infrastructure really gets a lot of the attention at these meetings. Some of the things are a little bit out of control of RiverCOG or regional governance structures, or even local governance structures. They don't determine the size of vehicles, of private vehicles, but everyone kind of has a role. And one of the areas is the Safer People and the education campaign that may occur. So just something I wanted to put on your radar is, as we think about Vision Zero and as we think about this goal setting, the role of the individual, and if you have any ideas, kind of thinking into the next meeting of how we can help educate people and get word out. We're really open to hearing ideas on this. So I'm kind of giving you some advance notice, but as we kind of progress through the study, I'm really eager to hear what people have to say as far as how can we reduce distracted driving? How can we reduce speeding, just from an educational component? The driver's education is a really important piece of this, and many of us take driver's education when we're 15 years old or 16 years old. But as we think toward the future, how can we be most effective in this? And would really love to hear, even if you don't have feedback tonight, just ongoing feedback on this, I think is going to really help us form a policy that's useful for the region. All right. Just concluding with some next steps to just let you know where we are in the overall process. So we're kind of wrapping up existing conditions. Our committee is reviewing the report as we speak. And we'll be posting that to the website later this month. Coming up, there's a few different things. So we'll be prioritizing projects, so working through the analysis, so thinking about those different levels that I mentioned. So, the crash analysis that Colleen has done, the equity analysis that we've done, and then the public feedback that we've collected. So definitely keep sharing your ideas in the tool, because it does have a role in helping us determine which projects will be prioritized. But again, this is just one funding source. There's other other funding sources that we'll be helping to identify as the project progresses. But prioritizing the project is kind of the big push for early next year, and for when we meet again, which will be late winter, early spring of next year. From the prioritized projects, we'll be developing planning level concepts, which is really going to help in applying for grants, showing the U.S. Department of Transportation that we have an idea that we've documented, and that we have some potential cost estimates and other elements is going to be really critical. And then we'll open it up to questions, but I'll leave this up for the time being, because I just want, my email is here, Rob's email is here. We'll certainly be happy to answer kind of questions along the way or receive feedback along the way. But again, that mapping tool that is listed in the chat is certainly the best way to identify specific locations and specific concerns, because we'll be analyzing that at a later date. All right. I saw someone, at least I got a notification that someone's hand was raised. We'll open it up to questions, comments.
Yeah, Paul, go ahead. We'll unmute you.
Okay. Yeah, I was wondering, is there a way to get signed up on a newsletter or something where we would be notified of future meetings and stuff like that?
Yeah, absolutely. Either send me an email. I don't know if our website has that option set up yet, but it will be something that we'll be adding. So yeah, you can shoot one of us an email and we'll definitely add you to the list.
Okay, thanks.
Yeah. All right. Cool. Well, certainly I'm going to stay on for quite a bit longer as I think we're scheduled to wrap at 7:30. So, if anyone wants to depart, definitely go ahead. But I'm here to have conversations, answer questions, or if you want to leave any additional comments in the chat. But before you take off, I just wanted to thank you so much for your time and your participation in this study. It's not only critical from just federal requirement perspective, it's really meaningful and helpful in helping us understand the existing conditions as well as the locations we really need to be focused on within your region. So I appreciate your time. All right, Paul.
Yeah, I think this was a great thing, and I've been pushing for years in the town for different things, and the last thing I've been really having to drive back and forth to work through this intersection. I've seen
Mhm.
so many missed calls and stuff like that, and I know Route 66 is just all the way through. And when they did the changed the road work and turned it to 4 lanes and stuff like that about 15 years ago or 20 years ago, that's when it really became even worse than I think it actually got worse than what it was before. Before it was congestion they were worried about. Now it's speed and just everybody going through the red lights.
Right. That driver behavior that we were talking about seems to be coming up in a lot of these conversations. And I know at least portions of Route 66 have been analyzed in previous studies, but I think that's kind of a little bit to the east of where you're talking. But yeah, it's definitely noted. That particular location sounds pretty gnarly.
Oh, okay, thanks.
Yeah, thank you.
Jane, I think you were next.
Yeah, thank you. I mean, so Paul must also be from Middlefield. I'm not sure. Um, the I wanted to segue on, when I looked at the Safe Streets for All information, it talked about pedestrians and bicycles.
Mhm.
And we do actually have a bicycle concern on State Roadway in Middlefield, 147, as it goes from Middlefield down to
Mhm.
Durham. That is a classic bicyclist, for exercise bicyclists road that has really no bicycle lane on
Mhm.
it. And it gets really dicey as it turns the corner and go weaving down toward Durham and Route 17. I don't know if this is I mean, it seems like the focus on this project regionally is more about vehicular crashes and things than it is pedestrians and bicyclists. But I know at least our town, in addition to the concerns of we expressed this evening about 66, um, the bicycle lanes on state roads. Even 147 up near Lake Besic narrows such that you're taking your life into your hands walking along the side of 147. I mean, there's no area next to it. Now it'd be difficult to create that, but again, so there's areas that from a municipality point of view rather than a regional point of view would be interesting to look for funding that would sort of qualify for pedestrian and bicycles,
Mhm.
even if Safe Streets for Roads doesn't fund it. I'd like to know more about that.
Yeah, definitely. And that's a really good comment. And it's definitely something that I just really briefly touched on in the presentation was the planning context review that we've done. So we've looked at a lot of planning documents, including bicycle and pedestrian related ones, because the funding, even though we spent a lot of time talking about vehicular crashes today, and some crashes involving cyclists and pedestrians, the funding itself is really looking for opportunities for bicycle and pedestrian safety. So having that sort of element highlighted in our prioritization process, it certainly won't be forgotten. Noting, that connection is really important, and it's actually something that in one of our stakeholder interviews was raised as well. So thanks for the comment about 147, because knowing now that it's kind of a critical route is really helpful for us. And I'll take a look at some of the data sources that we have available as far as bike routes go, to see kind of the routes that are currently being used, the most, and see how that can, factor into thinking about our different corridors. So definitely a great comment and noted.
Appreciate it, Michael. Thanks. And thanks for the presentation to you and your colleagues this evening.
Yeah, of course. Thanks for joining. Put my email back up in case anyone needs it.
Okay, I think people are starting to drop. Maybe at this point, we can take participants off mute if they have any further comments. There's just a few. Michael, if you agree with that approach, as we
Sure.
wind down.
Yeah, sure. And I can stay on, certainly until 7:30, but yeah, if there's no additional comments, we can wrap. But
Yeah, did Jim just leave? I think he did. I don't see him.
okay.
Yeah, because I was gonna tell him I was looking when we were just talking that DOTs actually just began an update of their active transportation plan, and they do have a survey out, and I was going to kind of post that.
Oh, yeah.
In the comments if you wanted it, but I know him, so I can send it to him in the morning. That's no problem.
Oh, great. Yeah, that'd be great. And I mean, for the participants who are on, maybe we drop it in too.
Yeah, let me see if
I
I
think-
can. It's on my other computer. I should be able to just cut it and
I actually have the link. I can drop it in because I was thinking of the same thing, actually.
Oh, okay, yeah.
So the DOT is in the process of updating their active transportation plan. I believe it's for 2025, and they're seeking public input right now for your feedback in your local area on sidewalks and bike lanes. So anyone can participate, and I dropped that link in the chat.
Yeah, and hopefully it'll be a little more interactive than the last time. I know a lot of people weren't all that happy with the public involvement, but it's a new consultant, new staff at DOT, so they're kind of they're really trying to get a lot of more public involvement right now. So we should be hearing more from them in the future.
I definitely went and put in my feedback for my area where I like to walk and bike. So it's good. The more feedback they get, and the better the study will be.
Yeah, I think they weren't supposed to be done until the summer of 26 or something, so it's a ways off. But I mean, I think they just made this the survey public. I mean, just 2 or 3 weeks ago. Pretty recent.
Yep.
Yeah, thanks for making that clarification about the bike pedestrian, because it has been a little bit unclear, and so that helped to clarify things for me as well. Thanks.
Yeah.
Thanks for the presentation.
Yeah, of course. See, Paula has a comment here. Used to walk her dog 3 miles a day. Oh my gosh. Lucky dog. Until I moved to Chester. So looking forward to doing that again. Okay. Yeah, thanks, Paula. We'll note that. I'm very happy to see, as a cyclist and walker myself, to see so much enthusiasm for improving that the infrastructure in the region on that front. All right. Right, seeing no one else joining, I'll give it another
When,
couple of minutes, but yeah. Oh, go ahead,
when,
sorry.
when is the latest date to try to add information to your map?
You know, I actually plan on keeping it open throughout the study. You know, so all the way really until at least the summer. But for the purposes of kind of helping us analyze, you know, because at some point we're going to have to use this information to prioritize projects. Um, you know, get us the feedback by the end of the year if you can. The 31st would be great.
Okay, all
Yeah.
right, thanks.
Yeah, and I know that seems a little bit you know, wishy-washy, but we're actually using this data throughout the project. So I don't want to tell people like stop participating in it, but how we're using it initially is that really just like understanding the locations of where the greatest concern are. So that's going to help us with the prioritization of these projects. At a later date, when we're actually developing concepts, we'll look to these comments to really inform the designs that we'll be proposing for the concept. So it's really useful to have that nuanced feedback at a later date. And at the very conclusion of the project, we'll be sharing all of the comments we've received with your municipalities, so that they have that available if they, in the event that they want documentation for their grants and their ability to go after and fund things, and also just their general understanding of what the concerns are in their community. So it kind of has this ongoing purpose that I want it to be, you know, benefit, you know, municipalities beyond just, you know, this particular funding source. But yeah, let's say the end of the year is probably the most critical, because in January, when we're back from the break, that's when we're going to dive into the prioritization. Great.
Oops, I was unmuted. You didn't
Oh,
hear. I was asking a question about
oh,
sidewalks. And is it worth pointing out the areas in Middletown where we desperately think sidewalks are needed, because that may lend itself to Middletown being able to apply for funds later that might give them a grant for more sidewalks?
yes, absolutely. I would go ahead and put that in there. And speaking of Middletown, Rob, do you have any updates? I know that Middletown has already successfully gotten a planning grant to look at, I believe it's Route 3, there's 4 roadways that they're already looking at.
Yeah, I believe it was what, 31766 and Saybrook Road, I think were the 4 that were in the initial application. It
Yeah,
was awarded, I want to say, a year after ours. I don't believe it's gone out to RFQ yet.
so are you saying there'll be a lot of overlap between that program that Howard applied for, or?
Yep, it is the same program, but it's kind of run differently between the the COGs compared to the cities. I think more of the cities are looking at, specific corridors, while, we're looking at a bigger picture.
Okay, well, more information is better than not enough information, so trying to highlight those areas for this study, even if it duplicates what might happen later, is probably important. That's how I'm gonna size that up.
Yeah, definitely. And I'm encouraging, whether it's on one of those corridors or not, if it's local, if it's, go ahead and put it in there. Because this is exactly more information and helping each other out is kind of what the tool is really designed to do. So, we'll be passing along the data and the feedback we've received to Middletown.
Yeah,
Okay.
Mark's on the advisory committee meeting as well, so he's kind of been involved with what's been happening with our study. So
Okay, I mean, I'm just, right now, there's not as much listed for the city of Middletown as I might have anticipated. So that's one of the reasons those questions come up for me. Okay, that's all from me. Thanks.
All right. Thanks, Beth. All right.
I'm gonna sign off.
All right. Have a great evening.
Thank you, you too. And happy holidays.
Likewise.
you too.
All right. I think we're probably safe to conclude.
Yeah.
So yeah, thanks everyone, project team and members of the public alike. We'll certainly be posting the presentation onto the project website, so more to come there.
Yep.
All right. Have a good evening, everyone.
Right.
Thanks.
Night.